Good evening and welcome once again. Now we are moving to another language. English session will start now. Today is our 1416th day of continuous webinar. Thank you all the faculties and participants for your support and participation. And today's our guest is Dr. JAVED AKHTAR. He is BHMS, BSc in Clinical Pathology, MPhil in Physiology, and he was the ex-member of National Council of Homeopathy and ex-chairman of Professional Developmental Program of Homeopathy in Government of Pakistan. And many years of teaching experience he have. Today is going to present a case of oligohydramnios cured by single homeopathic remedy. Dr. JAVED AKHTAR, you are most welcome to IFPH forum. Please, you can start now.
Good morning. Good evening. Assalamu alaikum. Today I'm grateful to all the IFPH teams and homeopathic doctors, well-wishers. Thank you for giving me opportunity to present a case. Today I'm going to present a case of oligohydramnios. It was treated by single homeopathic remedy.
Sir,
please.
Okay. Now it started sharing.
Thank you. I'm audible?
Yes, sir, you're audible.
Thank you. This is the introduction of oligohydramnios. Oligohydramnion is a condition characterized by a deficiency of amniotic fluid surrounding the fetus during pregnancy. Amniotic fluid is essential for fetal development, serving various functions such as cushioning the fetus, allowing for movement and contributing to lungs development. The condition can be diagnosed through ultrasound measurement of amniotic fluid levels. What were the causes of the oligohydramnios? Normally, maternal factors, dehydrations, preeclampsia, diabetes. Number 2, fetal factors, birth defect, restricted growth, twins to twins, transfusion syndrome. Placenta factors, placenta abruption, post-term pregnancy. What are the symptoms of the oligohydramnios? Symptoms and diagnosis. Symptoms often say asymptomatic but include leakage of fluid, decreased fetal movements, and a smaller than expected uterus size for gestational age. Diagnosis. How we can diagnose this amniotic fluid? Ultrasound is used to measure the amniotic fluid index, AFI. Amniotic AFI is stands for the amniotic fluid index, or the single deepest pocket STP of fluid. What are the risk factors of the oligohydramnios? For the fetus, increased risk of congenital anomalies, growth restrictions, pulmonary hyperplasia, umbilical cord compression, and complication during delivery. For the mother, increased likelihood of inductions or cesarean delivery. What were the management and treatment of this? Monitoring regular ultrasound and non-stress tests to monitor fetal well-being. Hydration. Maternal hydration, either oral or intravenous. Number 3, immunofusion. Infusion of saline into the amniotic sac during labor to increase fluid level. And next one is the delivery. Depending on the gestation age and severity, early delivery might be necessary. What is the prognosis? The prognosis varies depending on the underlying cause, the severity of the fluid deficiency, and the gestational age and diagnosis. Early detection and appropriate management can improve the outcome for the both mother. So here is the case, abstract of the case. A 27-year-old pregnant female at a composite gestational age of 29 weeks and 4 days was diagnosed with oligohydramnios with an amniotic fluid index measuring 6 centimeter. She was admitted to the hospital and underwent regular monitoring and maternal hydration, both oral and intravenous. Despite these interventions, there was no improvement in her condition. The fetal growth was lagging by almost 3 weeks. Being her first pregnancy, she was extremely worried. In addition to the conventional treatment, she consulted a homeopathic. After 5 days of homeopathic treatment, her AFI increased to 6.7 centimeter and interval growth improvement was observed on Dr. ultrasound. Here was the Segal protocol was used to evaluate the case. This is the abstract of this case. Oligohydramnios, you can already is mentioned over here. These are just pictures to show the oligohydramnios. And now I'm going to presenting the case. Basically, there are different protocols and methodologies to diagnose the patients. Here we use the Segal protocol to evaluate the patients and then their analysis. And as you know, in homeopathy, the individualization concept of individualization is very important. And what the patient says, and two things are very important to monitor during the Segal protocol. One is the CAR, concern adaptation reactions, and on the basis of concern adaptation reaction, and we can take the symptoms and evaluate the symptom on the basis of triple P. Triple P word is used: present, persistent, predominant. It means if the patient says anything, whatever he's saying, we will evaluate it and monitor it by the triple P. So patients is oligohydramnios, is age 27-year-old female. Her diagnosis was already diagnosed, oligohydramnios. Gestation age 29 week and 4 days. A5 6 centimeter, that is a decreasing. What is the patient version here? Tell me about when the patient was consulted to me. So I asked him, tell me about yourself. Patient saying, we are worried. I was admitted to the hospital for 5 to 6 days and recovered with the help of drip. The drip were continued at home, but my issue reoccurred. Initially, the amniotic fluid AFI was 8 centimeters. Then it dropped to 7 centimeters, and now it's 6 centimeters. The doctor have told me that the baby's growth is stuck at 29 weeks. When my blood pressure shoot up, it caused the placenta to be blocked. As you know, the role of placenta is to give the nutrition to the oxygen to the baby. The baby is not getting any nutrients. It's not growing. And the amniotic fluid index is also problematic. And then I have asked, what is your concern? So patient replying me, nothing specific, laughs. Just what I told you, everything was going well before, but now this issue has come up. The growth is stuck. I pray that Allah cures it. So again, I asked, doctor, so you are concerned about the baby's growth and potential premature birth? As she mentioned, because one thing here is very important. I'll never ask the leading question. As she mentioned about this before, then I ask again, show me your concern. The patient, yes, I'm worried about why the growth is stopped. And if the baby is born prematurely, the baby will not be affected. So patients was clarity, she mentioned these things, their concerns. So doctor, when did you start worrying? When did you start worrying? Patient, on April 28th, we found out through an ultrasound, the growth was okay at that time, but the amniotic fluid index was not. I got admitted to the hospital for 5 days at that time. The AFI reached 7 for my first baby. First baby means it's the first baby in early stage. Doctor, was there any else worrying you before this? Basically, the question is any tension, any events happened during this problem. Patient, my father had been ill a month before that. He has a heart problem. This was during Ramadan. He had a sudden heart attack. I am very attached to my father. So the patient told me basically the problem, when was the diagnosis? It was my amniotic fluid was decreased and the growth was stopped. So at that time, what happened? His father suddenly death, heart attack, and heart attacks his father. And then I asked, what do you want most right now? Patient, I want my father to get better quickly. Now my father is getting better. Then I asked again, what do you want for yourself? Patient, I also want my problems to get better quickly. So then, why do you want to be quickly? Patient, time is flying. I am pregnant and the problem will grow. So I want to be to end quickly. This is the case. Actually, this is the version of the patient's as she presented me. Whatever she says, everything as she says, I took the whole words for it. Whatever they feel and whatever she says, and my questions over there. This is a basically case. Now I'm interpreting this case. This was the ultrasound of the daytime when she was visited. So here is I'm reading the conclusion. Single live fetus with composite gestational age of 29 weeks and 4 days. Discrepancy of 3 weeks between parameter of USG and LMP. Oligohydramnios A5 6 centimeters. Umbilical artery Doppler indices normal. This was the diagnosis on the ultrasound. Now I'm going to interpreting this case, what the patient says and what the versions I'm analysis over there. The patient said, uh, yes, I'm worried about why the growth is stopped. And if the baby is born prematurely, that the baby will not be affected. Actually, basically, this is the concern of the patient. Patient having the severe anxiety, severe tension. So this is the main concern of the patient. Basically, if you take the case, there is a feel of the case, crux of the case. What is the actual crux of the case is this. Patient has a worried, concern, and fear is there. Patient says that I am too much worried. May baby not affected during pregnancy. So rubric I have taken here, fear, phobias, general, pregnancy during, child would be deformed, date. This is the actually meaning of this, what the patient says. Only the remedy comes single aconite. Then, as you know, this is very important in the case taking the totality of the case. And then the patient said to me, doctor, was there any else worrying you before this? Patient, my father had been ill a month before that. He has a heart problem. This is the during Ramadan. He had a sudden heart attack. I am very attached. Definitely, if someone is very attached to the person who is suffering with a loved one, then the problem was start. So it was suddenly heart attack over there. It was shocking news, basically. So the problem is being start from the ailment from, this is the adaptation of the patient's ailment from, mental shock from. This is the rubric I have taken over there. And third version is the What do you want for yourself? Patient, I also want my problem to get better quickly. Basically, patient's wish and desire, I must be cured immediately. This is what the patient says. And if, as you know, behind this, if the time is flying away, because if the time is flying, the baby may, the growth is stuck of the baby. Therefore, the patient demands. So I took the rubric here, carried desire to be carried first. What is the meaning of this? This patient desire, you want to take the treatment as soon as possible, must be cured. So this is the meaning of this rubric. And next one is the version is patient, time is flying. I am pregnant and the problem will grow. So I want it to end quickly. So it means time is flying. Meaning time is going to be definitely here is very important time. So if it's not treated before, it problem may get worse. It may the problem may get worse. So what is the meaning of this whole version? So patient actually what is saying, fear ascending. If time is going to up, so definitely when the time is going up, the patient has a concern over there. So therefore, the patient want carry desire to carry fast because it's fear ascending. Next version is sorry, this is the whole version of the patient, the crux of the case I have taken over there. And here, Aconite, this is the chart of this fear phobia pregnancy during childhood be deformed date. Number one. Number two, element from mental shock. Number three, carry desire to be carried fast and fear ascending. And this is a chart of the radar opus apex. And you can see here, I placed all the rubric that was taken over there. The remedy, whole case of this remedy comes aconite. Then aconite comes over there. It was this rubric was taken from the synthesis and Murphy rubric is used here. And now aconite was given to the patient. 6 potency was given for OD. In one a dose, one first day and second day and third day, once a day. And after the 7 days, I advise the patient to ultrasound. The A5 becomes 6.7. Interval growth seen on the ultrasound report. You can see this report. Here is a mention is the single live alive fetus, and Doppler ultrasound here is mentioned is umbilical artery was fundamental posterior. Everything was opinion. Here is opinion. Interval growth seen. Interval growth seen means that now the growth is normal. These are terms here used. Interval growth seen at the 7th day after I got the ultrasound of this. Now, basically, you can see with the work of the aconite. Basically, what over there, if you analyze the patient, what is the patient saying and what is the happen over there? Basically, when the patient was suffering from the ailment, what started his father's mental shock, and meanwhile, it was it was started of this case, and then concerns of the patient over there, she was too much worried about their babies. It may not deformed. This is a very beautiful rubric present in the homeopathic repertory. And this is a reaction of the patient and concern of the patient. Basically, this is a CAR, concern, adaptation reaction. This is a concern of the patients. And this concerns shows. And what is the role of this rubric and what role play the rubric over there, aconite? Actually, is aconite work over there basic, as you know, the crux of the aconite is over there. Death, fear with death and deformed over there. This is the main crux of this. And these fears, remove the fear from the patients, then the problem is being solved. Everything must become normal. And now I'm going to tell you what the kind of the rubrics here normally is present in the aconite during the pregnancy when we are normally when we are dealing the patients. Just I'm going to mention here what are the main rubrics, and these are the of the aconite during pregnancy, and what the versions of the patient and what the patient says. Number one is the rubric is anxiety pregnancy. Patient is very worried about their pregnancy during pregnancy. This is one rubric. If the patient comes to you and patient says whatever the problem was over there, as you know, in the homeopathy, we see the individuals, not the disease. We choose the patients. The patients, if the feeling like the worried about their pregnancy, is the one rubric is the aconite is present. Number one, two, aversion, affection for anybody. Pregnancy has no affection during. There are two medicines, there aconite and sepia. What is the meaning of this rubric? The person feels a strong dislike, a lack of interest in showing affection to others. This emotional state is especially present during pregnancy. So, I'm going to more explain what the patient, there are two medicine, aconite and sepia. Aconite and sepia, during pregnancy, patients have a over concern their pregnancy, and that time, this patient has no interest to of the affections, fondness, loving to others. Others means especially his husband, her husband, and even family members. She does not show their. Why? Why? Aconite, basically, when whatever the case over there, in homeopathy, during case taking in cycle protocol, you must ask about why. When your why is clear, it means you have to reach the right simulum rubric. So because patient having the fear death of pregnancy during number one, fear accident of, fear ascending of, fear abortion threatening. These are the basically another rubric is a fear previous mishappening over there. Also rubric over there. This is the main reason why patient having no interest to the affection to others, especially husband. And why the sepia? This is the difference. Sepia basically compromised. Her spirit is going to down, and she become compromised and become indifferent, no interest to others. This is the reason behind the sepia and aconite. Okay. Now, another rubric is the fear death of pregnancy during. This is a single rubric. Fear death of pregnant patients herself, having the fear she may not die during the pregnancy. This is a single rubric, a single remedy of only aconite. Another is the rubrics anxiety journal pregnancy in precordia about. This is the only single aconite. What is the meaning of this precordia? Precordia basically is a region of the heart. It is a chest region. This is a precordia. This is the anxiety during pregnancy. It symbolizes the natural fear and concerns about the health and the future of both the mother and the unborn child. The precordial area symbolize that the heart and emotion, indicating that anxiety is not just mental but also deeply felt in the body, affecting the person's emotional core. Just I'm going to say that in Urdu and Hindi, मेरी छाती में बहुत बोझ बना हुआ है. In pregnancy, patient having to say, मेरा बहुत बोझ है, I'm खफगान है. It's pregnancy. You can say the pregnancy, खफगान, बोझ. Basically, precordia. Precordia, here we use it symbolically. in especially mind rubric, we can use these words as a symbolic or metaphysically. We can say basically her emotions indicating anxiety is not just mental but also deeply felt in the body, affecting the person's emotional core. So this is the specific during the pregnancy. If the patient says, "I'm very, मुझे मेरी छाती पे बहुत जब से pregnancy है मेरी छाती पे बहुत बोझ है मेरा दिल डूब रहा है दिल वो कर रहा है I'm very depressed छाती पे बोझ." This is the specific words are using in वजन है आप words में. So symbolically this is only aconite. And another rubric is the fear falling up pregnancy during. So here is the falling up, not of abortion. Here is the falling. What is the meaning of this? Only single rubric. Fear falling up pregnancy during. The fear of falling during pregnancy can be seen in a deeper anxiety about losing control or failing during the critical, vulnerable period of life. It represents a metaphysical concern about the safety and security of both the mother and the unborn child, highlighting a heightened sense of vulnerability and responsibility. Basically, here is a very important thing to why the patients feel falling. Falling means it may be not happen to any accidents or anything others like the during the pregnancy, patients having the severe. Basically, normally patients are saying, do you have any concern? The patient says, मुझे डर लगता है गिर ना जाऊं. If the patient says in during pregnancy, so you can use the single rubric, fear falling up pregnancy during. Whenever the routinely when we ask the patients, you have any concern due to your problems? The patient says, कहीं गिर ना जाऊं, कुछ लग ना जाए. I'm very careful and this is that. So, so a very important thing, pregnancy. The patient so can take access to the specific way. Okay, another break is a pregnancy ailment during. That is very important. There are 20 medicine over there. If there is any problems, whatever the problem is over there, either it's oligohydramnios, polyhydramnios, whatever the other is, placental issues, whatever there is. So pregnancy ailment from during it means the pregnancy that causes us these problems. So you can take the rubric here, pregnancy ailment during. So very important. Next one, the rubric is a sensitive and oversensitive emotional pregnancy during extreme. What is the meaning of here? Extreme means the patients basically extreme in their sense as precious pregnancy. Number one. Number two, the problem is very highlighted, extreme in conditions. The patient is very emotionally sensitive during the pregnancy. So you can take the rubric here. This is a pregnancy-related rubric of the aconite. And thank you, Ji. This was the case of the oligohydramnios. And now the case is being finished and you can ask the question. Thank you to all of you, please.
Thank you, Doctor. I think we have more than half an hour.
Basically, today I have a small case there for I can discuss over there because today I'm going to left the time for discussion and whatever the person who can ask and I will go through over there, please.
Participants, if you have any questions, please raise your hands. Sir, what was the repetition of aconite? You have question in the chat box, sir.
What was the repetition of amniotic? Actually, repetition of the remedy possible is amniotic fluid. Can you ask the again question? What you want to actually?
Vidhi, you can directly ask the question. Vidhi Tulshan. Vidhi, please raise your hand. I'll unmute you. Vidhi.
What was the repetition of Aconite in 60. Okay. Actually, they asked why I repeated the basically why I repeated it. Actually, first I'm going to tell here, as mentioned over there, this is a pregnancy. I did not use the high potency. I used 6 potency. Because why I have 6 potency? And there is a basically when you potency is a very specific, very highlighted issues during the case taking, and what kind of potency normally the homeopathy says you can use the potency, high potency in the mental symptoms and in physical symptoms, and you can use pathological and small potency. So basically, here is a very precious. There is a pregnancy over there, and pathology is there. I use the case as a mental second protocol, but mental symptoms over there. But behind this, the patient is basically oligohydramnios, and I have used the low potency. Number one. Number two, repetition. They ask the question, what is a repetition? Basically, normally 1 or 2 doses are enough to the given to the patient. I have used 3 doses, once at the first day and second day, third day, because as you know that Dr. Master Honeyman mentioned over there, if there is an emergency or such a fatal condition, you can break the certain rules. Normally, in other cases, there is no emergency over there. I can use a single one potency, one, and then I wait 1, 2, 3 days, and if needed, then I am going to give. Here, I did not wait over there regularly 3 days. So, if it may, I can use single potency, it may give the result, but you can say that I did not wait for any complication. Therefore, I used the 1 and 2, 3 days only. This was that you are replying over there. And any question, please? Okay, the Dr. Ram, thank you. You asked the question: pregnancy during eclampsia case and management in homeopathic medicine. Basically, one thing I'm going to tell here: the management of the patient is in allopathy, orthodox system is the same as in homeopathy. There is no difference between the management of the system. Is only difference over there in the homeopathy only by the medicine. And here is very important. The procedures, surgical procedures, are same in the both sides, but only difference is the medicine. Here we take the case, and according to this, we are using the homeopathic medicine, and they are using the something allopathy system. They are using their own medicine. Management is the same of the both of the cases. Either it is a homeopathic system or allopathic system. Ji, please.
Sir, Ram
Fluid
Parvesh, sir.
balance in the especially oligohydramnios
Thank
is
you.
very important. Must be tension free. Fluid. It is.
Thank you, sir. Okay, very good presentation case. According to homeopathic treatment, according to law of homeopathic treatment, main cause of disease, according to homeopathic, invisible, anger, anxiety, grief, first grade of symptom. So very, very nice presentation. According to homeopathic law, according to अध्यात्म शास्त्र, मोह सकल व्याधिन कर मूला, तिनते पुनि उदय बहुसूला, काम बात कप लोभ अपारा, क्रोध पीत निज छाती जारा, तीनों भाई करहि प्रीति उपदहि संपाद दुखदाई, पर सुख देखी जरनी सोचे कुष्ठ रूष्टा मन कटुलाई, अहंकार अति दुखद डमरुआ, मद कपट मन मान नेहरुआ। इसमें हमारे तुलसीदास जी रामायण में भी बताए हैं कि कारण अदृश्य है, और हमारे होम्योपैथिक साइंस के डॉक्टर हैंडमैन जो फार्मूला दिए, फंडामेंटल लॉ दिए, मैथमेटिक लॉ दिए हैं, सोरा साइकोटिक एंड सिंथेटिक, सोरिक इन नेचर, and cause of disease invisible. Very, very thanks, sir. Very nice presentation, excellent session. Thank you, sir.
Thank you, sir. Thank you, sir. Thank you, sir. Thank you, sir. Thank you.
Thank you, Dr. Ram Parvesh.
Thank you.
Anyone else? And now doctor is available for the discussion. You can ask your questions and doubts here. Sir, any specific medicine for heart problem?
Here, actually, the question is this, that any specific medicine for the polyhydramine, polyhydramine, the word is the right word is the polyhydramines. Actually, one thing I'm going to tell you, here is some certain confusions. The word is a therapeutic. In homeopathy, the is also the subject of the therapeutic, homeopathic therapeutic subject is. Actually, this is a confusional word. Basically, homeopathy is a science, is the concept of individualizations. You cannot use the homeopathic medicine according to the disease base. Here you've seen it. What was the patient said? What was the patient's concern? What is the patient reactions? What is the patient says about reactions over there? Adaptation is over there. What is the most important thing where you have to see the patient? Problem, whatever the problem disease is, you know that I have shared the number of cases. Either it's a cancer case, either it is a depression, mental disorders, either it's a physical disorders. But you have to focus the patients. So there is no specific medicine. This is no nuskha in the homeopathy. As I'm going to hear, that I have concerns of this. For example, patient says, okay, doctor sir, I am feeling very weakness. So the rubric is a delusion poor. Patient feel like it. It doesn't mean some patient has anemia, but they don't feel like weakness. So basically, there are a number of symptoms comes to the patient, the number of things patient says to say. Here it is in homeopathy art. Okay, what things you have to choose over there. So you have to choose over there. Therefore, there's no specific medicine for this any disease. What is either oligohydramnios or polyhydramnios? Either it's most of the I have read the books because in the social media, this medicine is where the position of the body. This will change when I given the CM and with their potency. Actually, potency can use according to the severity of disease, and it is the problems related to that disease. And only a single remedy and a version of the patient. I suggested to the homeopathic community, especially, do not use as a therapeutically, because the clarity के साथ mentioned in homeopathic organon, you have to we are using in the concept of annualization. Thank you, please. So
hello.
Here is a very important.
Hello.
Sir, yes, sir, please.
I am audible?
Yes, you can. Sir,
yes.
Please.
Good evening to all respectable doctors, and thank you for Sir Dr. JAVED AKHTAR, who presented a very beautiful case. And it was not only a beautiful case, but also the beautiful selection of rubrics.
Thank you, Dr. Naveed. Your voice is gone. Very nice. Thank you.
Yeah, it is
So,
stuck.
okay, Dr. Ram, thank you. You have mentioned about this, treat the patient, not a disease.
And sharing with us. Thanks, sir.
Thank you, Dr. Naveed. Dr. Ram, you have mentioned very beautifully that treat the patient, not a disease. Here is basically it's a very you can say it's our deficiency in homeopathy. Normally, the people who comes from the little knowledge or whatever
Dr. Javed, your sound also, there are some glitches in your...
In homeopathy, first is a question is the answer of this. In homeopathy, we are treating the patient, whatever the disorders over there. We are not treating the disease. We are treating the patients. So it's very important. Thank you, Dr. Ram. Please. Any question, please, about this case and anything you can ask me, please. Actually, you can conversate it, why I've selected and what is the reason behind this. The objective of this, basically, one thing I'm very happy to reply you. When I'm treating the case in homeopathy, normally I have seen it. I can reply everything you can ask. Why you given? What is this? This is the beauty of the homeopathy. And I am replying you everything with confidence in what was happening over there. If you have any doubt over there, so you can ask me. Is it basically this patient comes from the other system of thoughts? They used all the treatment. What was the treatment over there? It was admitted in hospital. They are using the even she was getting now. It's not over there. And definitely it goes to the homeopathic medicine. The growth was stuck, and then after that, they are constantly monitoring with the patients. And after that, the ultrasound was changed over there. This is the basically clarity over there. The credit has gone to the homeopathic remedy, and patient definitely anxiety was stress level down, and everything was down. Yes, please.
Thank you, Doctor. Dr. Danish.
Any fetal anomaly, how to treat? Okay, actually, this is a very basically the question is any fetal abnormality, how to treat? I have, I think I have 5 to 6 cases over there. The patient told me about this such type of the patient. The patient comes to me with the ultrasound finding and all the diagnoses over there. The patient's thalassemia like that and other diseases like that over there. But one case, the patient who visited to me, which was the patient was a problem over there, a congenital defect of the patient's heart issues over there. And when I took the history of the patients, patient does not shows me the concern that here is mentioned. Normally, we are expecting that patient may not happen, my baby. But the patient says, in that case, patient shows some else concerns over there. Like my husband may not divorce me. So I have what is the concern over there and what is happening? Actually, it was a quarrel between my husband and my family-in-laws. Told me that it may divorced over there. The remedy comes that I think I do time ignitia like that the medicine comes. So after the delivery, patient was feeling normal, and that after that defect over there, you can't imagine it. Even I did work over the thalassemia patients. Thalassemia patients normally, especially in the thalassemic patients, I am treating the patients. Before this, if the patient consulting me, before this, what is the concern? They should conceive properly. That fear should not remain over there. And after during pregnancy, what is the concern adaptation according to the case taking. There are 5 to 7 cases which I have used in especially thalassemia patients. The baby was become normal. There is no thalassemia. But here is that basically you can say some deficiencies over there. For example, I advise the patient to go to the placental examination to take the test of during the first trimester. Patient did not visit to the test. Therefore, we cannot 100% rely over there. Is it worth of medicine either something else. So here is a big, because we are we're living in those systems where the patient does not will work wherever they are in this system. They are admitted in hospital. So complicated problems over there. But however, I got 5 to 7 results during the congenital anomalies like the thalassemia and other diseases. Please.
Thank you, doctor. I think here is a question.
Thank you.
In the chat box, process is invisible and
Here the question is Ram sir. Causes invisible again, sir. Okay. Make the poses. Thank you, sir. Thank you, sir. Sir, thank you, sir. Today, I basically normally, as you know, that I'm regularly delivering here there my article. So today, I thought I have to short the case
and
do
discuss.
not go more detail. You may not confuse there. So I'm going to giving you full opportunity. You can ask me whatever you have any doubt or any concern over there. You can ask me.
Yes, sir. It's really a very good session. And nobody never thought that we can do such wonders in those in this case of.
That is the reason that we are we have no such cases. We have no courage to take this kind of cases. That is
the thing is that most of the people may think that, oh, it's a case of hydramnios. So, we will have to think such remedies that will work with, just like in conditions where ascites or something like that, where we treat. But what Hahnemann taught us was entirely different. You just look at the case and find the totality, and the totality will result in cure. And that's how you made this case, and the patient's shock after hearing that her father got such a cardiac arrest, and after that she was really suffered the mental shock or fright or something, whatever maybe. But soon after that, some rubric you went up with, and you reached the simillimum by utilizing those rubrics and the particular symptoms that really guided you to aconite. But people may believe that it's aconite is a single an acute remedy, so you will have to find some chronic remedy. But your belief is that whether no remedy is an acute one, no remedy is a chronic one. All remedies has the same wavelength of action. Am I right, sir?
Very, very right, sir. I'm 100% agreed with you. Actually, when I uses this medicine, normally when I treat the patient.
Sir, I think there is a problem with your internet. We didn't hear anything from you. You have to repeat.
Yes, still the internet cell network is out of.
Hello.
Yes, sir.
Yeah, now it is.
Hello. Yes. Okay, sir. I'm really agree with you. Basically, it's no doubt there is a mention about this is acute remedy, this is a chronic remedy. But during case taking, I have used this aconite, belladonna in the severe chronic cases like the lymphadenopathy and like that cases. You can't imagine over there, sir. It works tremendous work over there. But the main concept of the Dr. Hahnemann is take the case, treat the patient, not a disease. So whatever the remedy, I don't think I never prejudice over there. What remedy comes, what the patient says, that's the version of the patient and what the patient says. This is the main theme over there.
Exactly.
Here is very important thing, sir, please.
Yeah, exactly. People are prejudiced in the view that we will have to go for such a chronic medicine with so many miasms covering in that, like that. But actually, it is not. It is the totality that really get the result.
Totality there.
Yeah. Uh,
Sir, here is my concept is the one thing I'm going to, sir, mention over there. As I'm treating a lot of cases, even so fatal cases. One thing about the miasmatic remedy. Normally, the doctors in books says that you can use the, if the psychotic miasm there is a syphilitic miasm, you can use this remedy. It means that when one remedy is your case taking comes and that is other remedy is the miasmatic. So Hahnemann says you can give only one single remedy. So it means at the time you cannot give the two. So I'm going to mention here, miasmatic is the basically theoretical portion for the guiding you. This is the basically under this tree. This is a symptom. It's basically giving the guideline to reach the totality of symptoms. This is my point of view. According to my approach over there, miasm is that just if you understand this is a psychotic miasm, then you have to take as a case taking. So remedy is one only. It may, as you know, which remedy is not miasmatic.
yes, sir.
No remedy is. All the remedy are miasmatic.
Yes, sir. That's right.
Something.
There
This
is
is
one
my
point
point.
in that. I would like to add to one point, sir. Every remedy has three phases. One has it has a psoric phase, then syphilitic phase, then psychotic phase. All these three phases will be covered by each every remedy. So it doesn't matter much. But when you get the right remedy in right time, that will work in all conditions. Am I right, sir?
Very right, sir. Very right. This is my actually I'm practicing physician and I'm treating the different type of cases, even the mental level, psychotic cases, neurosis, and physical disorders. Homeopath, I'm going to mention here, especially the doctor, homeopathic doctor, have a lot of responsibility. At the time, he's a gynecologist, he's a skin specialist, he's a psychiatrist, he's at the time he's a eye specialist. A number of specialists comes in the homeopathic because he must know it. In allopathic, it's very beautiful. One person has a one single specialist. In homeopathic, he's a consultant of all the disorders. So therefore, it's a great responsibility of homeopath. He must know all the pathology, all the diagnosis and prognosis and repertory and the nutritions and culture, even patient culture's values. He must know it. If especially in using the classical method, needs a lot of knowledge. In mind method, he must know the culture and religion of the patient. What is the important their religion? What is not important their religion? If someone says that I do this, that in other religion that is not so important. So basically, for example, if the say you can take some symptoms. So in that culture, that is not important. In other religion, that is important. So you can take over there. So this is a very important thing. It means the patient, the homeopath had a great responsibility to take the case.
Yeah, exactly, sir. Another point I would like to add, we used to say that homeopathy is just like mathematics because the total symptoms minus disease symptoms minus disease symptoms common to the people, then we get the common the rare remedy. Or rare remedy means the right remedy. Am I right, sir?
Right, right. Very
That's
right, sir. Very similar.
that's the
Okay.
simple.
Sir, here one thing I'm going to important. In certain cases, there is one thing I'm going to share here. What is the difference between that normally we are using the two methods. One the classical method, and second one is the Segel protocol. And also we are using some other methodology, but there's a very famous and very important cases. What is the difference between this? In the Segel protocol, you can use the mind rubrics, mind symptoms. And second one is the state of the mind. Mind symptoms and state of the mind. These are the, you can take them. What is the difference between the mind and state of the mind? Mind symptom is like the anxiety, fear, concerns over there. In state of the mind, what is the condition at particular time the patient is doing or not doing? Doing or not doing? At particular time, for example, if the patient who having a severe pain, severe headache. At that time, what the patient say, I want to remain better man. I want to just not have to talk to anyone. I have an anger. This is a state of the mind. In the Sagal protocol, you can take state of the mind. What is the state at that time? And mind symptoms. And in what is the difference between classical mind symptoms you can take over there, but state of the mind is not important. And you can take the general and physical symptoms. Here is one thing that is very important. If you take, as the research shows, if during the Sagal protocol, if you take the physical symptoms in the Sagal protocol, the case may divert. Because the number of the research shows when we take the SOPs over there, if you take something else in the mind symptoms, in the Sagal protocol, so you cannot reach the right simulum, patient will may divert. For example, if you take the rubric state of mind and you can take the physical rubric over there, so you will give the medicine if you think that is a correct remedy, but the patient will not respond. This SOP was clarity mentioned Dr. Sagal over there, and I am the team member of the research over there. I have used it. And so, for example, is a patient who comes to me, and I know the remedy comes according to Sagal protocol, this remedy comes. And patient shows this is a physical symptom. And when I analyze the chart, the remedy comes something else. When I've given, the patient did not respond. After that, I go through the proper SOPs over there. That I'm going to mention over there.
Exactly.
So this art must be known. This is a basically art. And how to reach. Sir, here is the basically, especially the word concerns, fear, apprehensions, and these words, it is very difficult to ask the patients, what is your fear? If the patient is educated and high-ranked person, he will never mention over there, I don't have fear. But basically, you can ask what you want to think about this. The patient say it may not happen, it will happen like that. So these are the basically these things are shows that the fear and apprehensions. In especially the best patient is the layman patients who belong to the Delhi area, who belong to villages. They're the best patient. If the well-educated and high-ranked person is very difficult to take the case because he will use the term, especially doctors, medical doctors. He will use the terminology. So we cannot achieve the word, the right symptoms, and he does not show their internal feelings. So at that time, what you will do it? You will do it when you, if the doctors who come to, especially medical specialists, gynecologists, and like that, the person who comes to you, I told them when you are suffering, how to talk to your mother, what you say your mother, because your mother is not doctor, it is a layman. Talk me like that. Don't use the medical terminology. What you are entirely feeling. If you say I like that, that you cannot achieve the things. Therefore, it's very difficult in such cases. So I suggest homeopath that you must be expert in taking the cases of the high-ranked person and medical doctors. This needs a lot different specialty. So you can get it. Thank you, sir. Please.
Thank you, Dr. JAVED AKHTAR, for your case presentation and discussion. Thank you so much. Come again. And now it is a time for the Malayalam session. I'm inviting Dr. P. Shaila for moderating Malayalam session. Thank you and good night, everyone. Bye-bye. Now we are moving to Malayalam session.